a lot of you have felt the recent push for evidence-based medicine. For those of you who are in clinic, you know that before you do anything, before you do any diagnostic procedures, before you put together a diagnosis, before you're allowed to touch a patient, a lot of these clinicians are going to ask you to justify the approach that you're going to use for that patient. They're going to ask you to justify it using Q angle to the patellofemoral pain syndrome. Does anybody know what the research technically says about the Q angle as it relates to the patellofemoral pain syndrome? That's wrong. You're answering all these questions in your head, I know. If you look at the research, it would explain to you that the Q angle has little to no effect on patellofemoral pain. Now, you know how those studies were done. They took a bunch of people with patellofemoral pain and they measured their Q angles. And they said, you know what? Not that the overwhelming majority didn't have increased Q angles. So therefore, it had nothing to do with patellofemoral pain. Now, I'm thinking and looking at that and I'm saying, what about those people that had an increased Q angle? They also had overpronation. Sorry, somebody said it. Radicular pain is a nerve root. A referred pain has nothing to do really with nervous system function, other than to say that the pain from a referred, when you have referred pain, the pain signal from the injured tissue has gone up through the afferent nervous system into the thalamus. Somehow things got messed up. It goes up into the sensory cortex. Sensory cortex kind of gets confused as to where the pain is coming from, and then it registers pain in various areas. Some people don't agree with that theory. They think it's the dorsal root ganglion that's causing that confusion off the thalamus. But generally, the point of this is that radicular pain goes along the nerve root. Referred pain does not go along the nerve root. Fascial stretching, massage. You guys have all the weapons you need to battle the finding of fibrosis and adhesion. How about the person that comes in with pain? What can you do for pain? Acupuncture, IFC, medication, TENS, spinal manipulation for, say, hot set, stretching. All of these things can combat pain. Inflammation, acupuncture, ice, medication, compression, elevation. Hypomobility, manipulation, mobilization, stretching, grasping, ART. Hypermobility, stabilization, strength training, proprioceptive rehab, motor point stimulation, EMS, PNS. You guys have all of the tools to combat any of the symptoms that are affecting any of the 7 tissues.